Welcome everyone to the Canadian Diabetes Association's Diabetes Awareness Month webinar series. My name is Farah Ismail and I'm a program manager here at the CDA and I will be your host for this evening. We're delighted that you're able to join us for today's webinar to learn all about strength in numbers and building your diabetes team. To start off, I'd like to draw your attention to this survey. It's located at the top right-hand section of your screen. In order to better serve your needs, we kindly ask that you provide us with your input by completing the short survey towards the end of the presentation. And we thank you in advance for your input. Now, throughout the presentation, you will have the opportunity to type in a question and answer box, and that's located at the bottom right-hand section of your screen. We ask that you use this box for any questions you have throughout the presentation, and our presenter will be happy to respond at the end of the presentation. As well, we will be displaying a few polling questions throughout the presentation. We'd love for your participation. Please note your answers will remain completely anonymous. Also note that you're able to customize your screens so you can expand and collapse them as you see fit. And you're able to do this by simply dragging the bottom right-hand corner of any of the webinar pods as you see there on your screen. Now, it's important to note the presentation will last about 40 to 45 minutes, and we'll have about 10 to 15 minutes left at the end to do some questions and answers. It is also important to note that our webinars, our past webinars as well as this one, will be recorded and posted on our Canadian Diabetes Association website at a later date. So now I'd like to welcome our speaker, Susie Jin, and thank her for joining us today. But before I turn it over to Susie, I'd like to give you a brief introduction. Susie Jin is a pharmacist, certified diabetes educator, and certified geriatric pharmacist. From within her community pharmacy, Susie enjoys collaborating with healthcare teams to take care of her patient. Beyond her community, Susie sits on a variety of interprofessional national committees. Susie contributes to guideline development and dissemination with the Canadian Association of Wound Care and the Canadian Diabetes Association. She has been honored with several awards. For more information on Susie, please read the speaker bio section, which is to the left-hand section of your screen. So without further ado, I'd like to present to you Susie.
Thank you so much, Farah, and I really have to thank you. Farah has done a wonderful job of putting these webinars together and bringing us all together, and we're really lucky to have you, Farah, on our team, so thank you. So today we're going to have, tonight I thank you very much for joining. I know it's very late in the East in Canada, so it's exciting to be able to have webinars and bring us all together. I want to make this a very interactive time so that everybody who's on the call can get the most out of it. And I find the most time, the way we get the most out of it is to keep it funny, keep it light, and keep it interactive, and keep it personal. So, getting along those lines, I've started by telling you a little bit about myself. In fact, you already know quite a bit about me. You know that I'm smart because Farah's made me look smart. Thank you, Farah. You also know that I'm hot because look at the picture. I mean, at one point in my life, I must have been hot because that's the picture. Just joking, I'm still hot. I'm really joking. But what you might not know is what I actually found out about myself as I was preparing this presentation. I went and I did the CAN-RISC questionnaire. And what you'll know, and certainly you can see from the picture that I am Chinese, so I have 10 points there. I will share with you that I have 2 family members who have diabetes, and so because of that I have 2 points, well, 2 plus 2, so a total of 4 there, which means already just through genetics and people who I'm related to, I already have a score of 14. And then with my birthday this year, I get 7 points. So without me even sharing with you and totally getting personal and telling you what I eat, how many vegetables I eat in the day, or how much physical activity I do, or how much I weigh, I'm already at moderate risk. So that was fun. That was interesting, and I welcome everybody who's on the line who doesn't know if you're at risk for diabetes to certainly go online to the guidelines.diabetes.ca. There's the resource there on your webinar screen, but also there's a box that has a set of resources, and you can click and get right to the link there. Now, you probably won't have time to do it because we're going to move on away from me and me sharing about me to you now sharing about you. And I'm going to ask you to answer the poll about how are you affected by diabetes. And I'm going to ask you to select all that apply. Many times you'll have diabetes, or you might also be a healthcare professional, and you might also have family members living with diabetes. And of course then, okay, so and of course some of people might not know yet if they are at risk of diabetes, and so lovely for the CanRisk questionnaire. And the other thing I like to tell people is that, did you notice from the CanRisk questionnaire, first of all, did you notice that it really did emphasize the fact that it is very much a genetic condition and a disease and a condition of the aging, or sorry, getting older or growing up. And so really that helps us establish the fact, or reinforces the fact, that there really should be no stigma associated with diabetes. It's there, and we have to recognize who's at risk, and we have to recognize what we can start doing early in our lives to live well. I also wanted to point out, did you notice when we did the CanRisk questionnaire that if you have diabetes, then technically you're going to add points to somebody else who you're related to. So encouraging all your family members to do the CanRisk questionnaire is a way that you can help other people live better. Okay, so we'll close the poll. Certainly we've had a lot of time to respond. And that's wonderful to see that we've had quite a gamut of people online, and I love it. I love it. We have, of course, there's more people that have type 2 than those that have type 1. That makes sense because, of course, of all the people that have diabetes, 90% are type 2 versus the 10% that are type 1. And we have quite a few that are at risk. So I love that you know that you're at risk. And this presentation will hopefully help you know how you can already start making early changes. And then, of course, we have family members. Lovely. Welcome. Thank you for being here. And healthcare professionals. What I really like to see is a lot of times people will ask me as a healthcare professional, why am I so passionate about diabetes? And I think the truth is that I really find that the more I know about diabetes, the more I realize that if we all lived as if we had diabetes, the better we would be. I mean, technically, there's no such thing as the diabetes diet or, living well with diabetes. There's just really living well, and we should all be doing that. So I'm happy that the healthcare professionals are online to give us an idea of what people with diabetes need to hear, as well as those people that that are supporting people living with diabetes. So today, where are we? Today we are December 2nd, and we're doing the presentation on strength in numbers. But this is part of a webinar series that really builds nicely along from Gail McNeil's presentation. You might not have been able to log into hers, and if you have, then that's great, because again, just like I was saying, how the more I learn about diabetes, the better I am. When I listened to her webinar, I was like, my gosh, if I could support not just people living with diabetes, but if I could support my friends and my family in general, just support people like that, talk to people like that, I would be a much better person. So I recommend you to go back and listen to her webinar if you didn't get a chance to yet. It will be available. It's not yet. I'm sure Farah's waiting for mine and for Jonathan's to finish, and then they'll be loaded up. But you can go to diabetes.ca/webinars and access past webinars. And quite honestly, in preparing for this presentation, I did go back to see some of the previous webinars, and my goodness, there's a wealth of information that's available to us through the Canadian Diabetes Association, all for free. It's very exciting what we have access to just through the Canadian Diabetes Association. So Today we're going to be talking about strength in numbers, and we're going to start with a video because I like watching movies. So pop some popcorn and let's watch that video.
The Canadian Diabetes Association presents Angie's story, from diabetes diagnosis to building a diabetes care team. Know your team, stay connected, prepare for your diabetes care, and live well. Angie is a 48-year-old mother of 3 who works full-time at a call center. Recently, Angie saw a post about diabetes screening at her local pharmacy. When Angie asked how she could be screened for diabetes, her pharmacist asked her to complete an online CanRisk diabetes risk assessment. The next day, Angie brought a printout of the diabetes risk assessment report indicating that she was at high risk for diabetes. Her pharmacist sent the results of the assessment to her family doctor and encouraged her to make an appointment to see her doctor soon. To help Angie before seeing her doctor, the pharmacist gave her information on diabetes risk factors, as well as prediabetes. Angie made an appointment and went to see Dr. Nelson, her family doctor, who reviewed the risk assessment report and asked her to have an A1C blood test in the lab right away. The A1C result came back indicating that Angie had type 2 diabetes. After a second A1C to confirm, Angie's name was added to a registry. Dr. Nelson uses this registry to keep track of all her patients who have diabetes. Angie asked, "Dr. Nelson, what do I do now?" Dr. Nelson worked with her to determine specific goals around her nutrition, weight, and activity. She was also given a prescription for 2 different medications, one to lower her blood glucose and the other to control her blood pressure, which was found to be high during her last 2 visits. Finally, Angie is encouraged to make a diabetes-focused follow-up visit with Dr. Nelson. Angie returned to the pharmacy to have her prescriptions filled. Angie learned even more from the pharmacist about how these medications work to help her with her diabetes, and she was reminded of the benefits versus potential side effects of each of the medications. Angie's pharmacist has extra training in diabetes and is a certified diabetes educator. It was helpful for Angie to talk about these new medications and how they work, to keep her blood sugar and blood pressure in the right range. Angie's pharmacist let her know that there are many community resources which will form a diabetes team to help her learn about diabetes and how to take care of herself so that she can live well. Her pharmacist told her that she could go to the local diabetes education program around the corner from her work, and that her doctor would send a referral for her to become part of that program. The local diabetes education program includes a team of diabetes educators who are nurses, dietitians, and physical activity experts. Angie was very relieved to be referred to this program because she knew that the team would be able to help her modify her diet based on her food preferences and her allergies. The team, including the diabetes educators, pharmacist, and family doctor, all work with Angie and support her as she learns the best way to manage her diabetes. This teamwork will help prevent the progression of the disease and complications that can happen if diabetes is not well managed. As Angie got to know her team, she realized that there are other healthcare providers and specialists, such as social workers, foot care experts, and optometrists, who can be called to provide support for her. Angie wrote down the names and contact information for all of these people on a list, and found some other helpful tools that she decided to use to track her goals and keep notes from every visit she had with a member of her diabetes healthcare team. When you live with diabetes, get to know your team. They work together and will support your individual needs throughout your life. Know your team, stay connected, and live well. Find lots of helpful tools to help you stay on track here. Me, my health, and my diabetes team. Now you know Angie's story. What about you? What would be helpful for you to manage your diabetes? Your action plan tools? Make an appointment with your doctor or at a local diabetes education program. Learn more about diabetes, risk factors for diabetes, and public programs at diabetes.ca or call 1-800-BANTEAM. Become a member of the Canadian Diabetes Association.
Okay, so Angie was newly diagnosed with diabetes. Let's find out about you. How long have you been living with diabetes? Okay, so we'll close the poll and see what we've got. Oh, lovely. Okay, so we have some people that are newly diagnosed, just like Angie, who have been living with diabetes for perhaps less than a year or maybe even 1 to 3 years. It's an exciting time for you because we now know that if you can get early good control of your diabetes, that the efforts that you put into getting to target at an early stage will have lasting effects, so that even if, as life happens, and life does happen, and we go up and down, that no matter what, even if you lose control later in life, that the effort that you've put in when you're early diagnosed will have lasting effects. So way to go, congratulations. Thank you for being on the call tonight, and hopefully you'll find out answers of how you can get into that really good control early in your diabetes. And what's really exciting is to see those people who have been living with diabetes for 7 to 10 years and over 10 years who are on the call tonight. And why I really like that is because what sometimes happens is people, you get used to living with diabetes, you get a little bit complacent. It's almost like, yeah, I know my sugars are high, but that's how it's always been, and that type of thing. And what I really like is that the fact that you're on this webinar implies or tells me that you're doing something to care for yourself. You're doing something because you want to achieve good care. And when people, even though you may have seen a diabetes educator, a lot of times, oh, I've seen a diabetes educator maybe 3 years ago, maybe 5 years ago, maybe 10 years ago. With clinical practice guidelines coming out every 5 years, and with us getting more and more information, it's such an exciting time for people living with diabetes now. We know more about living with diabetes now than we have in past, and we have so many more tools to help people get to target that we didn't have before. So I'm so happy to see that people who, even though you've been living with diabetes, and you guys probably could write the book, you know more about diabetes than I do, about living with it, certainly, that you're here and you're part of the call. And I'm hoping that we can make this whole webinar as interactive as possible. Share your experiences, share what works, share what, and use the chat box or use the question and answer, and Farah will read things out as we go, or certainly at the very end, because ideally what we want to do is when we are on each other's team, we will have better outcomes. Okay, let's take a look at Angie's story, and I hope you enjoyed watching that video. There was a lot of information that happened in Angie's story, and if I was to break it down, we saw Angie interacted with many different team members. She, of course, did the CAN-RISK questionnaire to determine that she was at high risk. Her pharmacist referred her, communicated, remember, the pharmacist faxed the information to the doctor or the family health, the primary care provider, so it could be a nurse practitioner, who then confirmed the diagnosis and made sure that she had access to resources, whether she went back to the pharmacist to get even more information about the medications, or whether she also went to the Diabetes Education Center where she had access to nurses and dietitians. Sometimes you have access to social workers and chiropractors, foot doctors, all these resources to help you understand your diabetes. But in addition to mentioning the names of different team members in Angie's story, we had an idea of what the team members can do for you. And I think that's important because many times we actually don't know what to expect of a healthcare practitioner. We don't know what we need them to do for us. And that's what this webinar is going to be about as well. It's going to make sure that you know what you need. And if one of the best things is that as somebody living with diabetes, puts you in the driver's seat. You know what you need. You go out and get that. You build your diabetes care team to care for you. So some of the ideas that you can do for you, because you are part of your team, is make a list, track goals, keep notes. Keep notes, and even if you use the Q&A box of ideas of things that you're going to adopt pursuant to listening to this webinar, things that will make you able to manage your diabetes better. That's the idea, is to keep notes. And then we will, I'm going to go over some of the different tools we have through the Me, My Health, and My Diabetes team. So let's take a minute and actually think about for a second, why is this important? Why is building your diabetes team important? It's such a funny topic to have a whole hour on building your diabetes team. I mean, in past, we've had talks on, the glycemic index, or how do you find out which foods are good for you, or how do which medications should I be on? But when you think about it, why are we doing a whole webinar on building your diabetes team, and why is this important? And the reason why it's important is one of the latest studies that came out was the DAWN study. The DAWN 2 is the follow-up to the DAWN study. And the DAWN study stands for Diabetes, Attitudes, Wishes, and Needs. And what it identified was that diabetes had a significant burden on daily life. I mean, when you think about it, the Canadian Diabetes Association has been publishing clinical practice guidelines for over 20 years. So healthcare providers, we have an idea of guidelines. We have an idea of how to guide our practice, which means if I was a good healthcare practitioner, I'd be following these guidelines and encouraging people to, achieve these certain targets. And then, of course, we'd be able to all have, reduced complications of diabetes. And when we did another study in 2013 and realized, oh my goodness, less than 15% of people actually achieve targets, we thought, oh my goodness, what's happening? It's not like it's new information and we haven't had a chance to really give it a try. So there must be another reason why the majority of us are not getting to target, are not actively reducing our risks of heart attacks and strokes and all the other complications. And so what this study did is it really brought out the fact that, beyond medication use and beyond going to see your doctor and getting blood work, there are certain factors that negatively impact the day-to-day activities, and these factors make it harder for us to manage our diabetes. So if we can address these factors, then maybe that's the gap. Maybe this is what's going to enable us to get to target. And so when I'm going to draw your attention to the bottom right, where you see 39% of people indicated in this study that they would like to be more involved in their care. And that's exciting because that's what this presentation is about. It's about putting you in the driver's seat and finding out how you can direct your care. And the other 39%, just a little bit to the left of that, 39% of family members are frustrated that they don't know how best to provide help. And so for those 39%, I do highly recommend that you listen to Gail McNeil's presentation, the past webinar on getting and giving support. But I'm so also happy to have you here because, it's really important that we're all in this together. So moving on, why is building your diabetes team important? Because it is all about you. And recognizing, and I'm going to change those words, recognizing what you already do well for yourself and where you can make improvements or what you can do. And so that's what I really encourage you to do is as we go through this presentation is to think about, oh yeah, I'm doing really good there. Pat myself on the back. I am doing that. That's what's working for me. But identify areas where, that's what I want. That's my next step. That's something I can do. And so you're going to see throughout this presentation that I'm going to give you hopefully different ideas of what you can do. And I'm hoping you'll grab onto one of them and run with it and manage and live better or live well with diabetes. So you can see that the diabetes team starts with you and you're in the center and the rest of us are all supporting you. But what I really want to point out is that what we tried to do with this graphic is show a whole variety of gamut of people that can help you. But really what it is a matter of you, if you're in the driver's seat and you get us talking and you go out and reach out to us, then certainly you know what, your clinical outcomes are going to be much better because you're going to help us support you. There are some people that might not, especially if you live in remote areas, maybe seeing a diabetes education center is actually harder. Maybe you don't have access to certified diabetes educators at a diabetes education center. However, when you think of the Canadian Diabetes Association being part of your team, you now have a wide variety of healthcare professionals that are available to you. So, you know, whether it's through the webinars, whether it's through calling the Canadian Diabetes Association, by all means, there's a lot of resources that I want you to think outside the box. There's sometimes, you know, life is challenging for many people, and you might not even like, you know, your doctor. That's a terrible thing to say, but, you know, and you might not have a choice. But what it is a matter of making sure that you create the team that's going to work for you. And you'll see that there's family and friends in that team. That's very important. Living alone is hard. Living with diabetes is even harder. Living alone with diabetes is even harder. So don't try to do that. I mean, the idea is for you to realize that the more people you have on the team, the more people that you have on your team, the better you'll do, the better clinical outcomes you'll have. And on the left-hand side, you'll see where it says other people you know who have diabetes. I want you to think about the fact that, well, right now we're talking about you being the center and you are creating your team. But of course, the evidence shows that you can have a significant impact on other people and you can help them improve their clinical outcomes too by sharing. So this is a graphic that shows us, gets us thinking about, you know what, maybe I don't have access to a dietitian, but maybe I can go to a pharmacist who may or may not be a certified diabetes educator, who may be able to give me some basics of just a start of what I can, of foods that I might be able to get. But then that person might be able to resource you out, give you ideas of where you can go. So ideally sometimes there's a lot of people that will feel, you know what, I don't have access to a social worker. I don't have access to a physical activity specialist. But sometimes it's a matter of recognizing what you need on your team. You're going to build your team. And even if you don't have access to that person, start with one person you do have access to, whether it be your doctor or your pharmacist or the nurse at the doctor's office, somebody that you can relate to, and start with that person and see if it can build out from there. Because hopefully through this presentation, you'll know who you need on your team. So talking about making a list and getting to know your team, this is a tool that's available on the guidelines.diabetes.ca website. It's also available in the resource. You can click on it. And the idea behind this tool is for you to have an idea of who you have working with you and keeping us all connected. If I know that you have a kidney doctor on or a physical activity expert on, if I make a recommendation to adjust your insulin, for example, maybe I should be sending a fax, or I should be sending a fax to all members of your team, including your physical activity expert, because that person needs to know, or I need to be communicating with that person of, you know, making sure that we're all working on the same page. And if that person has also increased your exercise, strengthening exercises, then really we need to make sure that we're all talking together. So I want to show you where you can access all these tools, because even though I have it in the resources that you can click on and link to, the idea is that if I can show you the website and you can go there, you'll see there's a whole bunch more tools available to you that you can do on your own time. So you'll see this, I've opened up a browser, and if you click on guidelines.diabetes.ca, you'll put that in at the top. On the left-hand side, you'll see the table of contents, and you can click on patient resources. And when you do that, the patient resources open, and you'll see that we've already looked at Angie's story, building a diabetes care team. We've talked about the next step if we clicked on me, my health, and my diabetes team. What would be all the different tools. And we've already talked about what does your team look like. We've already talked about know your team. And these are, the other ones are well, they're as we go through the presentation, but I really wanted to show you how you can access this on your own. Okay, so this is the Me, My Health, My Diabetes team, and we've talked about who you need on your team. But we actually haven't talked about how they can help you. And it's funny because a lot of times people don't know how people can help them. And that's one of the reasons, unfortunately, why some people don't keep their appointments with, for example, the diabetes education centers or whatnot, or their family doctors or nurse practitioners, because if we don't know the value of seeing this person, we don't appreciate what they can do for us, then sometimes we've actually not given them a chance to help us. So what I'm going to do with this next slide is I'm going to go over the basics of diabetes, the ABCDEs of diabetes. And once you know what you need to know and how these people need to help you, ideally you are in the driver's seat. And if they're not getting your A1C to target or your blood pressure is not to target, then you're now very much engaged, very much responsible, directing your future. So what is A? A for the ABCDEs is A1C. That is a measure of your glucose control target, which is usually 7% or less. B, which is blood pressure control, which is at this point less than 130/80 is our usual target. C is for cholesterol. LDL cholesterol is the one that we tend to emphasize, even though there's other parameters of cholesterol that we would get on a blood work. D is drugs to protect your heart. Now, I know that here this is under the vascular protection part, but when you think about it, drugs really could be the drugs of diabetes. And so ideally, we want to make sure that you are taking the best medication that's going to work for you to help you achieve targets. In this case, what I also want to emphasize is that, and this is a perfect example of sometimes you'll be taking medications or drugs to protect your heart even if your blood pressure or cholesterol is already at target. And that's an example of where some people feel like, what, if my blood pressure is already at target, why do I need to take these medications? Similar to having the same kind of thoughts of, well, I don't know why I need to see that doctor because I don't think it can really help me much. I know I have to do it on my own kind of thing. But ideally, if we give these people a chance to help us, then of course we're doing something for ourselves. And in this case, some medications such as ACE inhibitors or cholesterol medications can actually have additional benefits to helping reduce risks of heart attacks or strokes, even when your blood pressure or your cholesterol is already at target. E, I bet you're wondering when I was going to bring up exercise and eating. So that's obviously a treatment option, and that's something that we need to address as a target of making sure that if I want to live well, and let's not even say live well with diabetes, if I want to live well, I need to make sure that I'm addressing this component of my life. And S would be for stop smoking and manage stress. So we've talked about how the A1C is generally less, the target is generally usually less than 7% or 7% or less. But let's get to know you. And remember, I said learning is very nice when it's all personal. So we're going to open the poll to, I know what my A1C means to me. And you'll notice when I asked this question, I didn't ask that you know what your A1C means. I wanted to know, that you know what your A1C is. I know my A1C is 7.2%, or I know my A1C is whatever it is, the number. What I think is important is that we know, because remember, it's not always about what is the absolute number, but what does it mean to you? If you're a 7.2 today, and 3 months ago you were a 6.9, well, that's different than the person who was an 8.5 3 months ago who's now a 7.2. But even those numbers, what does it mean to you? Okay, so let's close the poll. And excellent. Wow, those are excellent numbers. Obviously, we have some very highly educated people out there. For those people who don't know what your A1C means to you, I'm so happy. Thank you for your honesty. That's one of the best ways that I can help. And what I'm going to do is I'm going to direct those people to the guidelines.diabetes.ca website. So again, if you go to the home page and literally if you click on your server browser, guidelines.diabetes.ca, this is the home page that will open up. And currently on the home page is another video for understanding your A1C. So ideas of how to better or change your clinical outcomes would be to really appreciate your A1C and what that means to you and how you can help get that to target. And watching that video will hopefully give you some tips. So we've done A, the B's. Yes, I know my blood pressure is supposed to be less than 130/80. And whether I'm there or not, what can I do today to help myself? And I know we'll go over different ideas like medications, we'll get there. But there's a lot to be said about the fact that we now know, and we've known for quite some time, that your blood pressure that you take at the doctor's office or the Diabetes Education Center is not always typical of what's actually happening at home. So for some people, a home blood pressure monitoring is recommended. So for those of you on the call, it's an idea to ask your primary care practitioners or your diabetes educators whether home blood pressure monitoring might be of benefit to you. And then we can get into drugs, for example. The next one, let's look at drugs. And I'm going to open the poll again. And we're learning about each other. I mean, I shared about you myself, so I'm asking you to share about you. Taking medication every day is a real inconvenience for some people. Thinking about the last week, have you ever missed taking a dose of your medication? Or do you ever feel hassled about sticking to your medication treatment plan? And if you answered yes to either question, I'd like you to answer yes to the poll. And no would be, obviously you think something's working for you, and that's wonderful, because we need to share how, different tips and tricks. And I think I'm going to share some of my tips and tricks. Okay, so we'll close the poll. And wonderful, I love that. Again, these are ideas of, if you answered no, maybe I can give you some ideas of what you can do to manage your diabetes better. I mean, certainly giving medications a chance, or even going in and speaking with your pharmacist to find out, why am I even taking this? Because it makes me feel worse. It doesn't even make me feel better. But having that conversation really gives you an idea of, oh, okay, that's why I'm taking this medication. Or sometimes people are taking it at the wrong time of day. There are some medications that are designed to be taken in the morning, and if you're accidentally hadn't been told and you're taking it at night, then of course it's not making you feel good or not working to you to optimize your care. So again, those 34.5% of people who perhaps are having challenges, finding challenges, and there's challenges of all sorts. For example, I know for me, my day is very, very routine. I always wake up in the same bed, so taking my morning medications is not a problem. But my supper medications, oh my gosh, I'm all over the place, and my supper time is all different times of day often. So, 5 o'clock, 8 o'clock, whatever time it is. So what that might mean is having a conversation if you tend to miss your supper medications, or you're finding that it's hard to get that in. Maybe it's a matter of having a conversation with your pharmacist to see if some of your medications could be switched to an extended release medication, which you then only have to take once a day, and your day starts with the morning and you take them and you're good to go. So that's an option of, making sure if drugs or medications are where you can improve your care, great, that's an easy answer, hopefully an easy answer. And then there's different compliance packs that may help. There's ones that the pharmacy can do for you. And what's nice about that, and in fact, I'll also show the one on the right-hand side, is the ones that you can purchase and do on your own. But either way, before you start setting these things up, I think it's always a great idea to meet with your pharmacist to double check if you're taking things at the right time of day, and can all these medications be taken together. So for example, if you're taking something for your thyroid and you're also taking a multivitamin, well, maybe we could try to spread those apart. So it's sometimes having a quick review with your pharmacist even every time a new medication is added, but certainly before you start, really making sure that you're doing things as best as possible and sticking to the regimen, making sure the regimen is right for you. So we've talked about D, A, B, C, D. We're at the E's for exercise and eating, and that's probably, for many people, one of the most challenging things. So let's look at our team. If anybody on the call is having difficulty with eating and making the right decisions and eating healthy on a regular basis, let's look at the team and think, what, I've been trying and it's, who else can I engage to help me with what I'm going to be eating? And many people will look at that team and say, well, certainly the dietitian is the one that makes sense. And it is. But suppose you don't always have access to a dietitian, because, I think it's great when you do. If you don't, we have to start thinking who else can overlap and help out. So, whether it be your doctor or your nurse, sometimes there's family health teams or there's a nurse in the doctor's office who may or may not be a diabetes educator, but certainly they are healthcare professionals and there's a lot of overlap and they can help. Certainly there's a pharmacist that can contribute to giving some basics. The Canadian Diabetes Association has a huge amount of information, and there's webinars and there's handouts and pamphlets that will give you ideas for recipes. But sometimes it's a matter of thinking outside the box and finding out. For example, I know in my community we have some grocery stores that have dietitians that are often certified diabetes educators. And these dietitians that are working in grocery stores can give you grocery store tours that can individualize your foods for what you what you like to eat. And they can give you cooking classes. So, I guess ideally that's what I'm hoping, that you'll look at this and try to find out what works for you. You are building your team for what's going to help you. You're recognizing your needs and building your team. Don't forget, certainly if somebody else is preparing the food or somebody else is grocery shopping for you, that person is certainly on your team, and you need to make sure that that person appreciates that even though maybe they are helping you and they are supporting you, that, if we go back to the fact that if we all lived as if we had diabetes, we would all be better people. Certainly you can just be a positive influence on that person. And then if we were to think about exercise, looking at the same graphic, who can help you with exercise? So I'm going to leave that for you to think about, and I'm going to ask my next question on the poll, which is, I am conscious about the amount of exercise, both physical activity and resistance exercises that I do in a week. I actively set time aside in my week for my exercise plan. And you'll notice, similar to the A1C question, I didn't ask, are you at target for your A1C? And in this case, I didn't ask, do you do 150 minutes of exercise every week? Because sometimes it's not about that. It's about making a plan and setting time for yourself. And I'll share with you one of my funny stories is I remember, don't forget, I at one point was this really young, hot pharmacist, and I was working in my pharmacy, and this guy came into the pharmacy, and I knew he was a runner, really nice guy. Anyway, I was making conversation with him, and I said, I'm going to run 10K one day. Yeah, I think it'll be fun. I want to do that. And he looked at me and goes, oh, great. Well, what are you doing to get there? And my jaw just dropped. I was almost like, well, that was a really rude question. I'm not doing anything. And you should have seen his eyes just perk up. It was like, oh, it was like, so you're not really going to get there ever, because I wasn't doing anything. So, I really like to share that with people, because it was the first time I was really called out on anything that, I have to make a plan, or else exercise is not going to just fall into my lap. I actually have to plan it. So just like if you set down on Sundays, there's a lot of people who set out their medications and put it into the dose sets, and they plan, I'm going to make sure I take my medications in the morning and then in the night, and they get that all organized, and they call the pharmacy, call for a repeat because they're organized and they want to make sure that they don't run out and so forth. At the same time, we need to sit down and plan our exercise and make sure we recognize that is part of our treatment. And when are we going to get a certain amount of exercise into our day? So we'll close the poll, and we're just over, almost equal, pretty much equal as to the amount of people who get exercise. So I think if we were to compare the numbers for how many people will remember to take their medications, that was higher versus how many people will actually get exercise in the day. So for those people who are making a plan, wonderful. You should share on the chat group or on your questions and answers your tips and tricks. My tip for people would be that when you take your medications twice a day, that you do your resistance exercises at the same time, twice a day. And where are you going to come up with these different ideas? So if you think of the Canadian Diabetes Association as being a huge part of your team, and if you go to diabetes.ca on the internet, and in the search on the top right, if you search the word exercise, this is exactly what comes up. And I'll point out to you on the bottom, there's the resistance exercise videos. Amazing, amazing that this empowers me to care for myself, that it's something I can do in the comforts of my own home, at my own pace, but I'm doing something for myself. So I welcome you to go and see what they have there. It's really amazing. And when you click on this exercise button, there's an incredible wealth of information that comes up, even tools of how to overcome the barriers to exercise, which is funny because it was almost like that guy talking to me really called me out on every kind of barrier or excuse that I could come up on, but it's a nice read. And the other thing that we can do is through the Canadian Diabetes Association, the next webinar series is Dr. Powell's, who is doing the presentation on exercise tips to help you and your diabetes on December 8th. So I highly recommend you to register for that. I certainly will be doing that because I know I need help. Okay, so we talked about exercise, and then we do need to address stop smoking and manage stress. And if that's an issue, we do need to, actually sometimes we don't even realize it's an issue, the stress part that is, and we don't recognize that we actually need help. So again, thinking about your team, thinking about the different people who are on your team, one of the first things to do is to recognize where you need help. And then the second activity would be to go out and actively search out what's going to work for you. So I'm hoping that, this opens up some ideas and empowers you to know that I do have options. So we've talked a lot about what can team members do to help you, and we've individualized it and made it personal. I'm hoping that you've had some time to think about what you can do to help you, what your needs might be at this time. The next thing I wanted to show you was this tool that helps you keep track of your diabetes, because as you may know, diabetes is a progressive condition, and so we need to make sure that that we're constantly staying in touch and we're constantly aware of where we're at. This tool is available through the guidelines.diabetes.ca website. It's part of the Me and My Health and My Diabetes team, and it does cover exactly what we've just finished talking about, the A, B, C, D, E's of diabetes. But what it also does is it tells us how often should we connect with our team? What would be recommended to make sure that we are staying in touch and caring for ourselves? Certain things that need to be done every 3 months, certain things that need to be done once a year. And the idea behind this is it's putting you in the driver's seat, so you know what people should be doing for you. So we have team members, and ideally by keeping our appointments to see them, we're enabling them to care for us. We're giving them permission to care for us. But what this tool does is it still keeps you in the driver's seat, and it tells you what they should be doing for you. And so the next one is another one that helps prepare you for your diabetes care. So on the left-hand side, what I love about it is it tells you, how to get ready for your diabetes appointment. In the most perfect world, where it says on the very first line says have lab tests done prior to your visit. In the most perfect world, when you leave your doctor's appointment, they'll give you a lab requisition to get done prior to your next appointment. But we're all human, and sometimes we'll walk out before remembering to get that lab rec, or the doctor might have forgotten to order it, or the nurse practitioner, sorry. So really, this tells you what you need to do. So maybe it's a matter of caring for yourself would be a matter of phoning the doctor's office before your appointment to say, you know what, I don't have a lab rec, and I think I might need one. Is there one that I would need, and is there certain labs that I need done? Can you have it, can I pick one up from the doctor's office and get it done a week before my appointment? So again, these are just tips and tricks to put you in the driver's seat so you know what people are supposed to do for you. On the right-hand side, further, sorry, I just hit it says what to expect when you go to see a member of your diabetes healthcare team. So again, giving you an idea of of the questions that you could ask, or certainly what certain parameters that you need covered to best care for you. So let's check back in on Angie. What else did Angie suggest that we can do to care for ourselves and build our diabetes care team? Well, Angie suggested we become a member of the Canadian Diabetes Association. So for those of you who aren't yet members, maybe that's a great next step that you can do to build your diabetes care team. And the way we would do that is you'd go to diabetes.ca, and from the home page, you can click on membership, and on the left-hand side, you sign up to become a general member. It is free. So again, all these resources that are available to you for free. So click on it and sign up now. And for the healthcare professionals that are on the call, I highly recommend you to join the professional membership. There is a cost for that, but by joining that, you are now, of course, integrated and part of our whole interprofessional team. I mean, you always are. I mean, of course, you're always welcome. But by joining up and receiving the different communications that we have, by having access to the different educational programs that are constantly running, it really just brings us all together and makes sure we're all talking the same language. It makes us perhaps a better person. Remember I was saying how if we all lived as if we had diabetes, if we were all connected to people with diabetes, we would all be better people. And I know that sounds so silly, but it's so true, I think. So I'm going to end with an action plan idea. I'd love it if you would write, the participants would write some ideas of what you might have got out of this presentation, some ideas of next steps. You know what? I know we've covered a lot of different ideas, like, whether it's just joining the Canadian Diabetes Association, whether it's making an appointment to make sure that the medications that you seem to sometimes miss or you're not taking for whatever reason, sometimes there's side effects. But maybe it's a matter of finding out what are my options. And maybe it's just a matter of going to the website and playing around and finding out even more information. But ideally, it'd be lovely that today's presentation results in action, that you can take some nice little tidbits of action that'll help you better care for yourself. And so with that, I'm going to leave the last slide with you thinking about your diabetes care team and thinking about the different people that you need to choose. I mean, I love it. A lot of times people don't realize that they have a choice, but many times the more choices you have, the more you realize that the team that you create is your choice, the better you'll do. Okay, and I'm happy to open it up for questions.
Thank you so much, Susie, for this wonderful presentation. It's been such an eye-opening experience, and a lot of our participants on the call have very much appreciated the information you've delivered today. So once again, we greatly appreciate that. Just as you said, we're going to get into questions, but before we do have a participant comment with regards to some of the lessons or learnings that they've had from the webinar. And I think one of the things that has stood out the most for participants is just understanding the different types of tools that are available on the CDA website. So thank you very much for bringing that attention to the participants, as they're now aware of the different types of things that are offered and that they can utilize to better manage their diabetes. So that's it's been a great share.
Wonderful, Farah. I'm so happy to hear that, that the hour that we've had together is being productive and wonderful. Good.
So with that being said, we'll start with our first question. And again, I do apologize if it's something that's perhaps out of your realm, but I do believe that your expertise is vast, and I believe that you'll be great with the question and answers. So with that, we'll start our first question. One of our participants has said, we are discussing our diabetes care team with professionals, but is it okay if my family does not know I'm diagnosed with diabetes? It's a personal choice, and I do not want them to worry.
That's an excellent question. So, you know, I've actually seen this in my practice as well. The more that you are willing to share and you know what, there's no right or wrong answer. I really should say that, because everybody has a different family dynamic, and you need to do what's most comfortable for you. But I do need to, you know, the truth is that living alone, or feeling like you're living alone, or feeling like you can't share, is actually harder to manage. There's a lot of people that don't like to take medications in public, or they'll hide the fact that they need to drop by the pharmacy. It makes life just so much more complicated. So sometimes, you know, one idea might be to recognize, well, why, you know, I mean, I know that you said you didn't want your family members to worry, but don't forget, by the mere fact that you have diabetes, their risk of diabetes has gone up. So you could be a positive influence in them by encouraging them to, you know, family outings could be, let's go for a walk. And I know that might sound silly, but my goodness, I'll do resistance exercises with my father, and, you know, my kids will make sure that it has to become part of their life. So if you can be a positive influence on them, that's great. And then I guess it's just a matter of making sure that you don't feel alone, making sure that what's the reason behind not wanting to share. And there's just a bunch of different reasons. I think that I hope I've answered it, but perhaps you know, absolutely speaking with your healthcare practitioners, I'm happy that you have that access to you. But, you know, the truth is that when you share and you can be a positive influence on other people, sometimes that's another angle to it.
Great. Thank you so much for that response. We'll move on to our next question. One of our participants has said, is it true that diabetes can be gone after all of medications and exercise and the eating habits have been accomplished? Can diabetes be totally healed?
So that's a great question. What we know is that technically once you have diabetes, you can't, it doesn't go away. But what you've done is you've managed your diabetes so well that you have pushed back the complications and extended out your quality of life by years and years. Like, we're talking 20 years can make a difference in pushing back heart attacks and strokes if you can really get to target and adopt that healthy lifestyle. But it doesn't mean that your diabetes has gone away. It's more that your diabetes is well managed with the treatment of lifestyle, of healthy eating and getting physical activity. We are often, like, even I showed you at the outset that I'm at risk of diabetes. And so I know if I didn't do what I can to take care of myself and so forth, that, yeah, I probably would have diabetes as well. So I often live like I have diabetes, because that's really, I think if we all lived that way and handled it that way, then we're really more of looking at it more healthy. And sorry, that's what I meant to say about the first one. The first question that was asking about, didn't want to share. We really want to make sure that, why is it that you didn't want to share? And sometimes people are afraid of the stigma associated with diabetes. They feel like if people were to know that they had diabetes, that they feel like people are thinking that they're lazy, or if they ate too much, or they didn't take care of themselves. And anybody who's well educated in diabetes knows that that's not true. So, maybe it's a matter of getting over that and realizing that if I share what's happening to me, I can actually make other people better. I'm just throwing that out there. It's not easy being the leader of making everybody else better, but there is always this negative stigma that's wrong in our society.
Great. Thank you for sharing that, and thanks for that response and the clarification for our first question as well. I just wanted to let you guys know we will be taking a few more questions, so we'll try our best to get them answered. But for the questions that we didn't get done today, please feel free to email us. So our email address is webinars@diabetes.ca, and our CDA employees will be happy to respond to any of your questions. Also note, I know we've already mentioned about the resource list that's there available in the webinar. Please make sure, if you'd like to download all the resources there. You can download them right onto your computer, and you'll be able to have access to all the different tools that was spoken to in the presentation today. I'll move on to our next question. One of our participants has said, I am a healthcare provider, and at this time I routinely order fasting blood glucose and A1C together to screen for diabetes. Patients find it difficult to fast overnight. Is there any value in obtaining a fasting blood glucose for screening?
So excellent question. So I want to specify that when I answer this question, it is about screening as opposed to monitoring over time. But when it comes to screening, you're absolutely correct that there are two parameters you can use, fasting blood glucose and A1C. If you order them both together and they are both above the cut points, and at that point I'll refer you to the guidelines.diabetes.ca website where you can go to the screening tool and click on that. Screening and diagnosis, and you can actually enter in the parameters, the numbers that come back, and the answers will show up. Oh, this person is diabetes. This person is at risk of diabetes. But the advantage the only advantage of ordering the two of them together is that if both are above the cut point, then you can make the diagnosis right then and there that that person has diabetes. If you've only ordered A1C, which I agree with because many times it is difficult for patients to fast overnight. So if you only order the A1C, so you only have one result that is above the cut point, then you would have to do a repeat A1C at a later time, and they don't even specify when, whether you want to give them 3 months to try to get their blood glucose back down to target so that you don't have to give them the diagnosis of diabetes. That's one option. Or whether you order it the next day if if you have two A1Cs above the cut points for diabetes, then you would be able to make the diagnosis. So I hope I've answered that, where the only advantage to ordering the two of them together is that there's no delay if both of them are above the cut points for diabetes.
Great. Thank you for that response. I'll just in the sake of time here, I'll move on to our next question. One of our participants has asked, are compression stockings necessary for persons with diabetes?
Excellent question. When we have diabetes, it affects our blood vessels, both our arterial blood vessels and our venous blood vessels. So the arterial ones are the ones that go out from the heart. The venous ones are the ones that bring the blood and the goop back up to the heart. Compression therapy is helpful to support the venous return. So if you have ankle swelling, it can be helpful. But because in diabetes we sometimes have compromised arterial flow, we have to be very careful that we use appropriate compression therapy. And if we use too tight, we could actually be having more of a tourniquet effect and could actually make things worse. So the short answer is that they're certainly not necessary. Could people benefit? Many times, yes. We would look for vascular changes in the ankles. And so, yes, absolutely, they can help, but you do need to make sure that you're cognizant of the compression level that you're putting on. And some people will order Dopplers. Some doctors will order Dopplers just to make sure that there's no clots or anything else that is affecting the arterial or the venous return before they'll actually recommend compression therapy for people with diabetes, if that helps. And sometimes, I guess, we have to be aware that when you have diabetes, you don't only have diabetes. Sometimes you have diabetes and congestive heart failure, or diabetes and other things that also affect whether compression stockings are necessary and the strength of the compression stockings. So just making sure that we cover the whole angle of the person when we look at compression therapy.
Great. Thank you very much for that informative response. We'll just take a last question here, and it's something that's come up more than once in the question and answer boxes. So some of our participants are asking, what are examples of physical activity specialists, and where can I find them?
Excellent question, because when we wrote that graphic, we were quite general in that. I mean, many times you might want to consider a physical activity specialist as a physiotherapist or some sort of kinesiologist or things like that. But when you think about it, you can go to sometimes there's like the YMCA, or there's a lot of different community programs that have access to physical activity specialists. And I know the YMCA often has a program wherein if you need financial assistance, you can make an appointment with the people at the front desk, and they'll put you in the right path, and you can ask for financial assistance in membership. So there are ways that you can have access many times to physical activity specialists. Sometimes it's true that people in Canada can live in very remote areas and not have complete access. So what I would recommend is two things. Speak with your doctor to double check. Sometimes when you can't go from 0 to hero, like me, I'm trying to run a 10K like that. But sometimes it's a matter of making sure with the doctor that, does the doctor have any concerns that you're going to start doing some physical activity? Sometimes that's a good first step. And other times it's a matter of finding out what your local resources are. So certainly this call is going across the nation, and so it's very hard to answer on a regional level. But like I had said earlier, when you try to find one person on your team, whether it be, go to your pharmacist and ask that person who is available in the community. I know in our small town we have actually a lot of people who work from their home who are physical activity, like motivational or inspirational people that help people stay on track. So there are options out there, and quite honestly, I believe some pharmaceutical companies have programs that you might be able to have access to that may help. Those programs are not always long-term running, but sometimes all you need is a little kickstart. So again, speaking with the pharmacy or the doctor might know of these different programs that might be available to you.
Great. Thank you so much for, again, another very detailed response. Folks, that does conclude our webinar for today. So I'd sincerely like to thank Susie for speaking on behalf of the Canadian Diabetes Association. It's been a wonderful learning experience for all of us here participating today. Do want to remind everyone that our sessions are recorded and will be made available, as we mentioned earlier, on our CDA website. Okay, so stay tuned for that. It's available in the coming weeks. We do want to send a quick thank you to our generous sponsor, Lilly, for helping make this webinar possible. And as we've already mentioned earlier, we do hope that you'll join us for our final webinar of the year on exercise tips by Dr. Jonathan Fowles. And our next series will start back up in February, so we're almost already into 2016. So we do hope that you'll stay tuned for that and you'll participate in our coming webinars next year as well. For any other questions or information or anything else that you might need to learn about any other programs or services that we offer at the Canadian Diabetes Association, feel free to call our toll-free number. That's 1-800-BANTING. So that's 1-800-226-8464. Or feel free to check us out on our website at diabetes.ca. We hope you had a great evening with us here, and thank you for participating, and we hope that you'll participate again. Thank you.